You can have two different kinds of obsessive compulsive disorder. You can either have OCD that is perfectionism, or you can have OCD the other OCD. Thank goodness you don't have OCD that's perfectionism, or you'd have a rough road ahead of you. I felt that I had no hope.
They said there was nothing out there for me. I ended up going into hospitals after hospitals. 2012, I was hospital 22 times.
I was told that I was severe on several occasions and that I needed long-term care.
I was just basically told to take my medicines. I was institutionalized, locked in the hospital, Grady on the 13th floor, where they basically didn't do anything but have these little sessions where nobody really asked me what I wanted. Nobody asked me how I felt or what I thought would work for me. I wasn't told anything about recovery.
I was diagnosed with chronic depression, and they said that I would never stop trying to commit suicide. But today, I have my own apartment, I have friends, I have my own life, I have a job, and I'm not trying to commit suicide anymore.
Recovery is, to me, is constantly going, but I wouldn't be able to do it had I not had peers to keep stepping into my life and keep holding me up when I'm falling, and I'm able to help others when they're falling.
And through peer support, you know, we help each other, and it gives us help for today and hope for tomorrow.
I didn't really know anything about recovery until I heard about Georgia Mental Health Consumer Network.
It's just a beautiful concept to have peer-to-peer support and relationships, and we have built these peer relationships that are going to last a lifetime.
My peer support people is my family and my heart, because my family don't understand me like they do.
I had no one, and when Danielle and Jocelyn came into my life, they just brought flowers into my life.
When I see her thriving and do better, I want to do better like her.
It's just something about being around people who share pain, and you know, we just always trying to figure out what life is, you know.
This is peer support.
Now I'm a CPS and a peer mentor, and I'm working with Georgia Mental Health Consumer Network, and I am living a dream job, and I do peer support, and I do a great job at it because I am living a life of peer-to-peer, and I'm helping people and they're helping me, and we're supporting each other, and we're able to get through each day just with that support.
You know, because I go to the center in Henry County as well, the house in Henry County as well, and without that house being there, because I have been in a total heavy depression state, and with those people not being there for me, I don't know what I had done. I remember one time I was driving my car, and I was like very depressed, and my car just pulled up in the yard. I don't remember turning up in there. It was only by His mercy and His grace. And when I walked in there, I just like broke down and grabbed Ginger, and held her as tight as I could, and I felt the love back. You know, out of even my so-called friends or my family wouldn't have done that for me.
When I'm going through something, I know I got good, clean friends that really care about me that I can go to and, you know, express myself and get feedback from them. And that helps me. That helps me daily. And it makes me feel good about myself. I don't have to sit there with my head down and hide my face no more. I can actually look up and they're smiling in their face and be proud of who I am today.
That helps more than anything when I get involved, when I come to events such as this, you know, and I thank God that people are recognizing us as people now and just stop labeling us.
I just love that I now get to be an example to people who thought that it wasn't even possible.
And so I've taken control of my life, and we all can. We all have the power to take control of our lives.
And this is what helps me to stay healthy. If we're all coming together for the same fight, then there ain't no way we can lose.
We are the evidence that recovery works.